Medicaid is the most expensive and inefficient health insurance scheme in the world. What can Republicans do about it? Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. Republicans are facing withering criticism for proposing to slow the growth of Medicaid spending from 2.4% a year to 2%. Democrats are screaming that the GOP is trying to gut the whole system, leaving tens of millions of beneficiaries with no coverage at all. So savage are the attacks that some congressional Republicans are opposed to even this small reduction in the rate of growth, even though Medicaid outlays would expand some $1.5 trillion over the next 10 years. The fact that both Medicaid and Medicare are financially unstable in their current forms haven't determined Democrats' demagogic attacks one whit. Why let the truth get in the way of scoring political points, however irresponsible? Democrats cover up the fact that Medicaid's miserly reimbursement rates to medical providers has numerous physicians refusing to treat patients in the program. As a result, patients are experiencing longer wait times for care, and the quality of what they end up getting is often perfunctory and even subpar. Fundamental reforms that provide good care at less cost are desperately needed. Many such changes won't come from this bitterly divided Congress, but the GOP should start laying the groundwork for what must come. Short term, if Republicans don't wilt, several critical reforms can be enacted now. Two crucial ones stand out. One already has broad public support. That is, requiring able-bodied recipients actually work to get benefits. Medicaid was originally designed to help the poor, such as low-income pregnant women and the disabled. Democrats see Medicaid, however, as a glide path to enact a single-payer government-run health care system like so many other countries do. To that end, they have let the program expand far beyond the basic safety net, chiefly through bribing states under Obamacare to substantially add people to the program and also letting people in willy-nilly during the pandemic. Millions of people, mostly men, are perfectly able to work but have chosen to drop out of the labor market. The reform here is simple: no work, no benefits. Another basic change involves the way states have been gaming the system to get extra Medicaid money. In some cases, some of that cash has ended up paying for non-health activities, including even buying mini refrigerators for privileged bureaucrats. Here's how this scheme works. But the state can get back from Uncle Sam $2 or more in matching funds. Providers end up with a windfall. Hospitals get back more than they paid in those taxes. Here's how the scheme works. The state imposes so-called provider taxes on hospitals, clinics, nursing homes, and other health care facilities. The state then returns the money to help finance Medicaid. But the state can get from Uncle Sam $2 or more in matching funds. Providers end up with a windfall. Hospitals get back more than they paid in those taxes. Longer term, fundamental reforms can turn Medicaid into a model for rescuing our whole health care system by having patients control the money rather than government bureaucrats. To begin with, we must break the rigid, disastrous, one-size-fits-all mentality by block granting federal Medicaid money to the states and let them have the flexibility to change their Medicaid programs. This would encourage cost-conscious decisions. Too often, providers charge wildly different prices for the same service. It would also spur more doctors to treat Medicaid patients because they would be paid immediately instead of waiting for months. It would also push the creation of a consumer-based healthcare market where patients would be in charge, just like consumers are in just about every other market. Along these lines, states should see if these health savings accounts could be set up to allow beneficiaries, if they so choose, to buy private health insurance. Republicans should start to get the ball rolling to save Medicaid now. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.